Infection, acute abscess. The infection is suppurative and caused by pathogenic organisms. The most common one is Staphylococcus aureus coagulase positive. Pathogenesis, direct access, local extension, blood stream or lymphatic spread. Direct access from infected wounds or along the natural passages like the lactiferous ducts. Local extension from an adjacent focus like otitis media or dental sepsis. Lymphatic spread from a septic focus to the regional lymph nodes. Bloodstream spread, cases of bacteremia or pyemia. Pathology. The abscess is formed of three concentric zones: a central zone, an intermediate zone, and a peripheral zone. The three zones of an abscess in histopathology. The central zone. The central zone is formed of coagulative necrosis. The abscess cavity contains liquefied slough and pus. The liquefied slough is caused by enzymes of the dead leukocytes and by the inflammatory exudates and plasma cells. The pus is formed of inflammatory exudate, dead and leukocytes, necrotic tissue, and dead and living organisms. The intermediate zone, it is formed of granulation tissue. It prevents the spread of bacteria and their toxins. The peripheral zone, acute inflammation fading gradually into the healthy surrounding tissues. Photographs of abscesses. The fate of an acute abscess: either resolution, pointing and rupture, or spread of infection. Pointing and rupture, the most common sequel, occurs along the plane of the least resistance. Resolution occurs in cases of high resistance and early treatment before the pus formation. Spread of infection by local blood or lymphatic routes. Transformation of an acute abscess into a chronic one. Formation of dense fibrous tissue surrounding the pathological area, leading to formation of a mass with little inflammatory reaction around. General signs: fever, headache, tachycardia, and anorexia. Local signs: painful tender mass, skin redness, edema, regional lymphadenitis. Changes on pus formation. The pain becomes throbbing. The fever becomes hectic. The skin shows pitting edema. The inflammatory reaction becomes localized. The leukocytic count shows shooting leukocytosis with shift to the left. Shift to the left means the presence of immature forms. Treatment before suppuration by antibiotics to avoid formation of the abscess, rest, hot fomentation, and general supportive measures. Treatment after suppuration: free dependent drainage on the pointing point, breaking down of the leuculi, and a counter incision might be needed. The meaning of free dependent drainage. Free means that the incision allows direct wide access to the abscess cavity for easy spontaneous drainage without obstruction. The meaning of the dependent drainage. Dependent means that the incision should be dependent to help spontaneous discharge of the whole contents to the outside by the effect of the gravity without the need for squeezing. Antibiotic treatment, cultural sensitivity tests to choose the suitable antibiotic. Antibiotics are essential in cases of compromised immunity. Hilton's method for drainage of an abscess in dangerous areas. Small skin incision away from the site of the abscess, thrusting the tip of a forceps subcutaneously parallel to the skin surface towards the center of the abscess cavity. Redirection of the tip of the forceps towards the center of the abscess cavity, followed by widening of the blades to widen the opened abscess wall. Withdrawal of the forceps outside and insertion of the index finger inside the cavity to break down the loculi and evacuate the contents. Insertion of a corrugated rubber drain inside the cavity and fixation of the drain to the edge of the skin wound. Good luck and best wishes.